Hello, my name is Penda Boma. I am a student of Nightingale College. Today I am going to be performing personal protective equipment skills, PPE skills. And for this video, I have my equipment, which is a gown, a face mask, and some gloves. Personal protective equipment can differ when entering an isolation room depending on the type of isolation room you're going to be getting into. So today I have my equipment and I am going to proceed by performing hand hygiene. I have no jewelry on and my nails are neat. Okay, I have performed hand hygiene. So I'm going to be putting on my gown first. When putting on your gown, it is very important to make sure that your gown fits properly on your body. And then this gown comes with two ropes, one behind the neck and one in the back. So I'm going to start by tying the rope behind my neck. I am ensuring that I tie this properly so that no part of my body is not exposed. To proceed, I'm going to go ahead and tie the back of the gown, bearing in mind that no side is loose and that it is covering all of my body, all of my uniform. I'm going to adjust the camera so you can see what I am doing. Okay, my gown is on. I have to make sure that it fits me properly and that it is covering my uniform. No part of my uniform is showing. Yeah. I want to also ensure that the gown is above my wrist. My gown is on properly. It is covering my uniform and it is above my wrist. Next, I'm going to go ahead and put on my gloves. Not my gloves, my mask, sorry. You want to ensure that the lining is at the top. It feels like there is a metal wire in there. That is the top of the mask. So I'm going to go ahead and put on my mask. I'm going to ensure that it is covering both my mouth and my nose. It's important to do a little pinch at the top so you can get a better fitting on your face when you put on your mask. Next, I am going to go ahead and put on my gloves. See how I am ensuring that no part of my skin is showing. Very important, because we don't want to be contaminated in any way. Infection control, very important. And this procedure has to be performed before you enter the patient's room. Before, very, very important. Okay, my gloves is on. It is covering the wrist of my hand. Even the gown is below the wrist of my hands. So my gown is on, is properly fitted, and is covering every part of my uniform as well. My face mask is covering my face and my mouth, my nose and my mouth, and I feel very protected right now. So I'm going to go ahead and proceed and enter into the patient's room. I am in the patient's room, and I have provided proper patient care. Now it's time for me to leave the patient's room. In some cases, there is an after room provided to discard your PPE equipment. So first, I'm going to start by taking off my gloves. When stepping in the patient's room, I put on my gown first, and then my mask and my gloves. But when leaving the patient's room, the order is different. I will go ahead and take off my gloves. I will proceed with my gown, and lastly, my mask. So to take off my gloves, I'm going to pinch inside, pull it out, pull it out into my hand, make a ball, put it in my hand, and then to take out the other gloves, I'm going to send my hand inside to avoid contamination, and I'm going to roll it over the other gloves. By doing so, I am preventing myself from being contaminated by touching the areas that have been used for patient care. I'm going to discard the gloves into a biohazard container. Next, I'm going to go ahead and remove my gown. By so doing, I have to untie the string behind my head. It is important that I make sure that my hand is not touching my face or my hair, just the rope, to avoid contamination. I have untied the rope behind my neck. Now I'm going to untie the rope behind my back, so I focus on the string only. I focus on the string only. The string behind my back has been untied. So I'm going to proceed by touching the inside of the gown, the part that is on my body, which is the less contaminated part. So I will send in my hand, grab the inside of the gown, and pull it out away from my body. Now that I have this side out, this side that is on my body is the less contaminated part, so I can use it and pull this other side out. And then I'm going to roll the inside part that was on my body, and that is how I am going to roll this gown all the way while avoiding to touch the part that was outside my body. And I'm going to discard this too. Next, I'm going to take off my mask. By doing this, I have to just pull one string away from my face, and then I pull the other string away from my face, and I'm going to discard the mask as well in a biohazard container. Sometimes in different facilities they may have a different type of biohazard container that they use depending if the PPE is going to be reused. Now that I am done providing care, I am going to go ahead and perform hand hygiene again. And that was my demonstration for personal protective equipment skills, the PPE skills for an isolation room. Thank you so much.